Hey, Dr. Minetti, how are you?
Oh, welcome. Are you Mr. Duggar?
Yes, how are you?
Oh,
it's
good
a
to
pleasure.
see you
It's a pleasure to
again.
finally meet you. I know you're a very
Yes.
busy doctor. I brought some things for you. Is this a good place to sit?
Yes.
Awesome.
Come on, sit
thanks
down.
Thanks for carving out the time.
Do you want water? Anything you want?
Oh no, but this is for you. So if you drink coffee or tea, that's for you from WellCare. Also for your office staff, Subway gift card, and Starbucks gift cards. Because I know they have to do a lot of work for you, and we appreciate that.
Well, you come here bearing gifts. This is awesome. Thank you.
Oh, no problem. This is my business card. My cell phone's at the bottom. Text me, call me, anything you need at any time. We're here to support you. So thank you. I know that when I scheduled this meeting, we let you know that we had conducted a mock survey related to CAHPs, which is member satisfaction. I know you've got 316 patients. 32 of them responded. I know that seems low, but it's about our common response rate. Why this survey matters is because the health plan star rating is based upon about 25% of member satisfaction in the health outcome survey. So we conducted the survey telephonic. Members had a choice in language, so if they spoke Chinese or Vietnamese, on the call prompt they were prompted to choose that language. So it was in July and August, and then we just tabulated the results, and so I wanted to come out to you and just review your results with you.
So how we do? How do we do?
So overall, not bad. There's some areas of opportunity, but perhaps you may already be working on some things that will address these areas.
Oh, we do a lot of work here. You know, my receptionists, my girls, they're so good with the patients. Like, they're gonna just walk them in, and they're gonna be really nice to them, offer them anything they need. You should really see it. You should come and sit down, and you should watch them. They're so good, so good.
I mean, 32 responses. It was the 7th best response rate in our state. So we do see that your patients are engaged.
Oh, you see, it's true. It's true.
So the first segment is access to care. So patients found it easy to get care, tests, and treatment. 85% of your patients found that it was easy to get tests and treatment, and the national average was 85, so you're on par, and your score last year was 80, so you went up 5%.
Oh, good.
So excellent job. Patients getting specialist appointments as soon as needed. This was an area perhaps we could work together on. 65% of your patients said they got appointments as soon as needed, so it's about 20% low. Is there any specialist we could bring in the network that could kind of help supplement your specialist network to get patients seen faster? Any type of specialties that you do?
Yes. You know, my parents always complain about not getting access to Dr. Freed.
Dr. Freed.
He is an oncologist. He is not contracted with Easy Choice Health Plan. And let me tell you, he's been trying to get in lots and lots of times. He always gets moved from one place to another place, and he complains to me because I want to send him patients.
So do you have a personal relationship with the physician?
I just know that because a lot of my patients, they always want to request him.
Okay, so if we got that physician in network, it would help your network out a lot.
Yes, he's in the same building as me.
Excellent, and that makes it a lot easier on our patients. So if we can get Dr. Freed, that would help things out.
Thank you, thank you.
Patients getting appointments for routine care, again, 85%, great job. So again, you're 5% better than last year.
Very good, very good.
Patients getting appointment for urgent care. So I know this can be a challenge because some patients want to be seen as soon as they want to be seen, whether it's Saturday morning at 7 a.m., Sunday night at 9 p.m., 65%. Anything you're doing in your practice to help that sector of patients getting urgent care, extended hours, anything like that?
Mr. Duggar, when you walk into my office, what did you notice? Right on the screen.
Your
right
office
on the
hours.
glass.
Oh yeah.
If you looked at my office hours, every Tuesday, every Thursday, I offer extended hours for my patients between 5 to 8.
Oh, excellent.
And I noticed that they don't want to go to urgent care. They want to come and see me.
Of course. So is there a way that we could partner as a health plan to do a postcard mailing to the members of your members to remind them of this new office hour availability?
Yes,
excellent.
Go for
excellent.
it. Bring them in.
Excellent. What I'll do is I'll have our team work on that. That will do a postcard mailer.
Great.
That would be great. Patient was seen within 15 minutes of appointment time, 85%. Again, 5% better than last year, and that is the NCQA CAP standard. Walking in the door and being seen within 15 minutes. Great job.
I tell you, my girls are on it.
Excellent, and we can't thank them enough because we know that that's the first point of reference for the patient. So doctor communication, It looks like you do a great job of explaining care in a way that's easy to understand. 85%. Your score last year, again, 80. The doctor listened carefully to the patients. Again, 20% below the national average. Do you know like the nature of your visits, or are you triple booked, double booked, or why would patients think that perhaps that you don't listen carefully? Because it's a perception question.
I want to tell you this, Daniel. Where we are, where we're located, we serve a lot of the underserved. And when you serve a lot of the underserved, they ask for certain things. They ask for benzos, and you know there's a big crisis in the United States.
Yes.
I don't just give those meds out. I
Yes.
don't. Because you know what? It's wrong. They need to go see pain management for those kinds of medications because it's my license on the line,
Yeah.
and I'm not gonna sacrifice my license for someone asking for the drugs.
You're an excellent physician, and I totally understand why that could be the perception of some patients want a specific prescription and they don't get it. They could be frustrated that you're not listening. But on the contrary, patients are treated with respect and courtesy by the office staff. Your team's great, 90%. So
Thank you.
this is 5% above the CMS national average. Doctor's office helped manage care among different providers and services. This is a tough one because we're at fault for this too. So we understand that it's not easy when you don't have a staff model, but what can we do as a health plan to make it easier on your staff to help coordinate care amongst you? You know, you mentioned Dr. Freed in oncology. We can bring him in the network. What else could we do to help you improve this score that was about 20% low?
Authorizations.
Authorization turnaround time?
Yes. Let me tell you something. When I send the authorizations over, I don't know why, there's always a delay. Always a delay. And I keep talking to them. I talk to them every month on this. And the patients, they don't like to wait. They need to get this right away. If I order a wheelchair, they need a wheelchair right away.
So, Dr. Minetti, could we help you maybe do like a monthly tracking, like on an interim basis for the next few months to track on the turnaround time on our authorizations to see if we can put some dedicated resources behind that? Is that all right with you?
Yes.
Who could I work
Talk
with on
to
your team?
Evelyn.
Evelyn. thank you.
Evelyn. She's very, very good. She always puts the authorization in on time.
Excellent. Thank you. And let me tell you, 90% of your patients said they received a flu shot. So so what's your best practice? What are you doing?
Before they go out, we tell them, we gotta give you a flu shot. You know why? I round in the hospitals every single week and I see my patients. It's winter. You know what they're all in there for? COPD, all lung diseases. So what I need to do, I need to get them the flu shot so that they don't go in the hospital.
Wow.
So I have my staff tell every person before they go out there, we're giving you a flu shot, and we give it to them.
Wow. But excellent job again, 90%. That's 10% improvement over last year and 5% above the national average.
Thank you.
So,
Thank you.
lastly, overall satisfaction. So, the rating of the healthcare quality of your patients, the 36 that responded, again, 85% said that they have a high quality rating of their individual healthcare. Rating of the personal doctor, you could say these are the same patients who say you don't listen, 65%, which is about 20% low. But it really looks like with the additional specialist network, advertising these office hours on Tuesdays and Thursdays, and working on this authorization turnaround time, I really think we can partner together to get that rating up for next year. And really, members see the health plan through the lens of their physician. So they also rated us about 20% low, the rating of the health plan. So their overall satisfaction was a bit low. But I also think we have a clean project plan to improve some of these small areas. So lastly would be the health outcome survey, which is a small percentage of the CAHPs result or the STAR result as well. So has your doctor given you any advice in the last 12 months about physical activity? 85% said yes. So that's a common.
I tell them all to exercise. They can't be getting healthy if they just sit down and watch Oprah all day. You need to understand that. They need to get out, they need to walk, they need to be active.
Do you tell them about our 24-hour fitness membership? That's zero cost to the members?
Oh, I didn't know about that.
Yeah, so zero cost to the members, 24-hour fitness, or if they want to go to any gym of their choice, Silver Sneakers, Gold's Gym, Planet Fitness, you get $20 a month rebate back to the member.
Do you have a flyer I
Yes.
can give to
What
them?
what I'll do is I will bring you. Is there any languages in particular you need for your office?
Oh, Spanish, Vietnamese.
Okay, so we'll bring you benefit. I'll bring you the 2019 benefit flyers, and it's got a highlight page, and on that page talks about our fitness benefit, and it's any 24-hour fitness too. So even super sport, which is great. In the past year, here's another question: have you talked to your doctor about falling or imbalance? It's a tough one, but 65% of the members said they did. So that's about 20% low again. Is that a common discussion point that you talk about risk of falling?
We say that every single assessment for all my older patients. You know why? Because they always get risk for fall when they have the osteoporosis,
Yeah.
when they start to have the sarcopenia because they have the muscle weakness, they more at risk. So I ask them all of the visits. I don't know why they score like that.
So maybe it's a memory issue. Like maybe if we send them like a postcard or some type of reminder that, you know, in February when they visited, you actually did talk about risk of falling. So bladder control, good job.
Don't you have a social worker visit the patient, talk about the fall too?
Is that okay with you if our social workers, field case workers go into the field and visit your patients?
Yes, let them go. Let them go.
Excellent, thank you. Some physicians and doctors are a little territorial, but thank you. You're talking to them about bladder control, so 85% again there. 60% say their health has improved. Again, these are Medicare Advantage patients, so it's a challenge, right? That they are getting older. So is there anything you're doing on like your annual visits that remind the patient of their improvement year over year in certain measures?
Let me tell you something. Most of my patients were older patients. They have a chronic disease,
Yeah.
COPD, CHF. What these are, they're the silent killers. So they just start to drop down. My job is to make sure that they still have good quality of life while they have these chronic diseases, because they can never get better. But at least I can work with them, optimize medication, share with them lifestyle changes, so
Right.
that they have a good rest of their life. But most of them don't get better. You're talking about Medicare patients, okay?
Understood. And you have a lot of Medis on your panel too, so I understand. Is there any patients we can get in complex case management that may feel like their life gets better if they have that personal touch on a regular basis?
Oh yes, Edgar Martinez.
Edgar Martinez,
Oh.
excellent. So he's a good candidate for complex case management.
13 emergency room visits in the past 4 months.
Yikes, that's not good for you or me.
Yes.
We'll get Mr. Martinez a phone call.
Actually,
and-
more than a phone call. You talked earlier about having someone visit them, a social worker.
Okay.
Let me tell you, Medi, a lot of social determinants of care, behavioral health concerns, need somebody to really evaluate him, get him in the right programs, because sometimes he doesn't have a home to go to. That's
Wow.
why he goes to the emergency room.
So we'll make sure that the notes from the visit get faxed back to you so you can put those in his chart.
Thank you.
Thanks for
Thank
that
you.
referral. And that goes to say mental health. 90% said that their mental health has improved. So of course, it looks like you're hitting the mark there. So good job. Thank you, Dr. Minetti.
Thanks.
And then lastly, these are some of our opportunities and key tips, but really, you're doing a lot of these. It sounds like you've got the after hours on Tuesdays and Thursdays. I know Monday mornings are a heavy volume time. Do you do anything unique on Mondays to help address that weekend surge in appointments needed?
I have an extra staff member,
Oh,
part-timer.
great. Like a nurse practitioner?
Yes.
Excellent.
And then it works every Monday morning, Wednesday morning, and Friday morning.
Oh, great.
She helped out a lot. Big help, let me tell you, because it's hard to cover all these patients, but to have that extra help makes a big difference.
And for medication refills, are you doing automatic 90-day?
Oh, that's what she does. She's good with that texting stuff.
Okay, great.
So she can work that.
Excellent. And what's her name?
Oh, her name is Olivia.
Olivia, excellent. I look forward to meeting. What I'll do is on my next visit follow her, I'll make sure I come while she's in the office on a Monday or Wednesday morning. And so it looks like you've got urgent care. It looks like we've addressed some specialty needs in your network. You must use Quest Labs, because it sounds like your members get their test results fairly quickly.
Yes.
And we've got a national deal with Quest, so they're held to performance standards.
It's right downstairs, the Quest Lab.
Oh, that's right. I did see that in the directory right before the elevator. See, if I just pay attention when I walk in your office, it would be a lot easier for me, right?
Thank you.
And please just remind the patients, the CAHP survey is in Vietnamese and Spanish. Only about 800 of our members get that. It's about 30,000 members, so it's really small. But if you remind them around February that if you get this packet in the mail from Easy Choice Well Care, just please take a minute to fill it out because it helps you and it helps us. The flu, I don't even need to tell you, 90% of your members are getting the flu vaccine, so excellent job. I think I have my takeaways. Dr. Fried in oncology, sending out the postcard for urgent care office hours to all your members. Work on authorization turnaround times. We can track and trend that. Flu shots, you're doing an excellent job. I'll come meet your nurse practitioner on a Monday or Wednesday or Friday, and we'll get Mr. Martinez enrolled in complex case management. Is there anything else WellCare can do for you, Dr. Minetti?
Mr. Duggar, very well done. Let me tell you, thank you for listening to me, and I hope to have good partnership with you for all our future patients. Thank you very much.
If you could text me on my cell phone sometime today, so I can make that personal connection with you, and that if at a moment's notice, if you need anything, I can be of service to you. Thank you, Dr. Minetti.
Thank you very much.
Have a wonderful day.
You too.